So, I'm an efficiency nut, okay? And look, I think you've all learned that you're at a point that patients are different than your classmates, okay? You know, some classmates have some interesting things, but they're still generally good observers, and they give you answers that are, for the most part, accurate, right? Okay? But real patients don't necessarily do that nor follow the script, okay? So, let's imagine that what we're scoping, and part of the, just want to set this to get our starting point right. Part of the point of what I'm at, and again that relates to the retinoscopy, is every 30 seconds more you spend with your retinoscope getting a good starting point should save you 2 minutes in refraction, okay? I know for some the retinoscope's like, auto-refract. So much better than an auto-refractor in terms of giving you insights into really, really what's happening. So learning how to use the retinoscope and doing it well and having it be dependable is really going to help you with refraction, okay? And as much pathology disease work as we do and have expanded into as a profession, and I think it's wonderful, one of the things people come to us for is to get a darn good pair of glasses or contacts. They want to see well, okay? So no matter what we do with the other, we still have to do this part, and the better we can do it, the faster we can do it. And so we also have a limited amount of the patient's attention, right? And I think that's the part that you're learning. If I can be more efficient, I can, before they run out of attention, I should be able to get somewhere, okay? So let's imagine, and so again, that's the backdrop of, and this is, I'm now 40 plus years, I'm in my 41st year. Yikes. Maybe in 42nd, I graduated in 1979. Yeah, 41, yeah. So, it's a lot of experience, and I'm just going to try to share it with you. So this is what I scope. Critical to get your sphere starting point at the correct place, right, before you do any cylinder testing. So I know this isn't how you're taught, and I'm not saying this is the right way, okay? Do you understand? This is just from years of experience. I use the red-green test target to basically see how close did I come with my sphere in red. My working distance is probably exactly halfway between 150 and 175, okay? I take out 6 clicks, so I take out the 150. That means my red should still be slightly red. Do you understand? So I close, target I put is probably 2080 to 2040, half red-green.
So you're still, okay.
Wide open chart, lots of stuff, red-green. We good? Okay. I'm also got minimal chart changes you're going to see here. Okay. So letter, get the size right, and then red-green. Okay. Which side's blackest or clearest? Letters on the red side or the green side? Red. Ah, yes. I'm a good red.
That's binocular, right?
What's that?
You're asking them one at a time.
Correct. That's why you
Okay.
see I've shut this one
Okay.
down. Okay. And you usually get an immediate, okay, red. Okay? How about now? What do I usually get? I get that pause. You know what I mean now. First year, saying, well, you get this pause. It's like, I don't know what you're talking about. But now you have an idea. They're faster response, they're slower response. One more click, green, I go in between.
Okay.
Got it?
Mm-hmm.
If it had switched, if it was red at 075, I go to 1 and it's green, I'll stay with the first green. If I go red, pause, whine. I don't usually wait for an answer. If I've been sitting at this lens for twice the amount of time it took for them to say red with the 075, I just move on and I go, how about now, green, and I just go back to the middle one. You understand? I don't wait for the answer. The pause is the answer.
Yeah, a lot of people have a hard time saying, especially with JCC and stuff, when things look the same. They never want to say.
We're gonna get to JCC in a bit, okay? All right, so now, close, open. There's no rule that says thou shalt do all the right eye stuff before the left eye, okay? The way I think of it is I've got my chart set the way I want, right? And their mindset is already in red-green evaluations, okay? Sphere set here for cylinder testing. Let's get my sphere set here for cylinder testing. Which side's blackest or clearest? Letters on the red side or the green side? Red. Thank you. Hesitation. Green. Come back here. Got it?
Okay, so after they say definitely green, go one more click of plus.
Try.
Yeah.
Okay.
Or if there was so not always, if it was red immediately to green, I'll stay on the first green.
Okay.
If it was red, pause, green, I kick back
Okay.
to the middle one with the pause.
Kind of like how you do FCC.
Yeah.
What's that?
Kind of like how you do FCC. You do like the most plus, or you land in the middle. Whenever they're
How
not
about we
deciding.
get to those when we get to them?
Well, I was just comparing the process, like how you think about it, like to the.
But I haven't shared how I think about it, and I only know how you've been taught, okay? And they're not always the same.
Right.
Okay? I have a bias in the FCC, and in the unfused cross cylinder, my bias is always towards higher plus. Okay?
Okay.
Always towards higher plus. All right? It's a probe, it's a test, it's not a candidate prescription. Okay. Chart change. Now I go on our M&S, I go letter, line, 40, 40, 40. Okay? So I don't have FCBD4, but I have a random 2040 line. By the way, when you settle into a particular location, that becomes your office, you can set M&S so that every time you hit a button, it is a random line. You don't go to the standard ones first. I have no idea why we don't set ours that way, okay? But you can set it that way. Now, in doing cylinder testing, my goal is to get out of the cylinder testing in no more than 5 questions, okay? So, if my red is a good starting place, and the patient's JND, just noticeable difference, is reasonable, I should be able to get out of this in no more than 5 questions. Okay? So, and a very quick comment about your JCCs. Okay? In the AO copies, which is what we're using. Okay, these are all copies of the American Optical RX Master, or whatever it was called. Okay? So even though this isn't made by AO, this is the copy of the AO, all right? In all of them, your JCC is basically built into the device, and you cannot change it. I have over here an old greens. This is the Bausch & Lomb, and this is actually the one I used in my practice, not this exact one. And on this one, the JCCs, see this one is marked plus minus 037. Oh, this is a later model. Mine, you just could pop it out. And it came with 025s, 037s, and 050s.
Cool.
Okay? And my strong advocacy is you should swap out the 025s for the 050s to increase the just noticeable differences in what you're doing. Most of our patients, and this has nothing to do with socioeconomic or more minorities, less minorities. It has nothing to do with that. In my practice, in a suburb of Baltimore, I never use the plus minus 0.25. I use the plus minus 0.50. Make a bigger difference, and the patients will give you more reliable answers more quickly. Okay?
Makes sense.
Now, know that you have in your trial lens set, some students called it the lollipop, but you have a handheld plus minus 0.50. So I'll just tell you very quickly, if you start and you're like, this patient, okay, grab your plus minus 0.50 to make a bigger difference, okay? And you may find that things move along more quickly, okay? So here's what I do. My goal is now to never have to ask more than 5 questions. I've scoped a cylinder. Here's what I do. I'm going to first increase the power of the cylinder before I do anything to increase sensitivity.
You increase it just by one click of what
One
you got?
click, just
Okay.
one click. By the way, everything I'm telling you now is I've published in Taub, and I do a thing for review of optometry, focus on refraction. So there are individual articles, one of them is specifically on the cylinder stuff, and I have every step of it laid out, okay? And the first thing I do, if it's only a 3/4 sill that I scope, I'll throw it off by 15 degrees on purpose, okay? And I'm going to do axis. Remember, I only have 5 questions. It's like 20 questions, but only 5. Okay, anyway. So, I do axis first. Put it at 105. I scoped it at 90. Which of these do you prefer? Away from where I'm scoping or towards where I'm scoping? Now, a couple of things real quick on cylinder testing. If you let a patient drive this by saying, could you show that to me again? For the rest of your life with that patient, they will be controlling the refraction. And I say very clearly, look, I want your first impression. Any one wrong answer is not going to mess up your prescription. Okay? So just tell me which you prefer. I use prefer. Black or clear or bolder. There's a gazillion things. Okay? So, towards where I scoped or away. Now, this is also one more quick thing. I did a number of the second-year checkouts, not this year. I don't know, it's the first year I wasn't invited to even partake in them. But that's a chance when you sit in and watch students sort of do their thing, right? And what I see is wild, fast flipping. It's a little bit like what I talked about in 304 with cover test. And it's like the flick needs to be quick, but you need to give them a chance to look at the darn thing. And I think sometimes, which better, this one or this one? And it's like, what are you doing? Okay? First, I think there's an assumption that whatever's in there, the patient's been looking at, so they must have already stored it in memory. But they might be thinking or listening or solving some world life, issue or, until you finally say, this one, or this one, okay, that moved around, but I take painfully longer in the time before I make my flip than most students. Make sure they have a chance to look at it, but essentially I think demand an answer the first time, okay? Don't let them control it.
If they ask to see it again, do you just assume that means like equal?
No, I won't assume. I'll give them one mulligan.
Okay.
Okay? You all know what a mulligan is?
Nope.
No.
Yeah.
In golf, it's a complete whiff. The ball's still sitting there. Mulligan. We won't count that. Just try it again. Or ding, ding, ding. Okay? Right? We're not counting that. It's a mulligan. Okay. It's a gimme. All right? Then I'll explain, look, any one wrong answer, I need your first impression. Okay? Just tell me.
Okay.
Okay? So one time, but I don't want them controlling it. I've got a patient, I can picture him, every single time I do this is like he's going to go back again, It's like, I didn't train him right. I let him control the whole process. So conceptually what I'm saying is, which of these two do you prefer? Towards where I scoped or away from where I scoped? That's not my words, okay? And of course the patient goes, Dr. Harris, you're wonderful with your scope, of course, towards where you scoped. Okay? Then I throw it off 15 degrees on the other side. Okay? The higher the cylinder, the less I push it off. So at 250 still is only going to be 5 degrees. And I'll shift it off, just to give you a sense. 15 is the most. And now, so I've burned one question, which do you prefer? Towards, this is away from where I scoped or towards where I scoped? Towards. You're a really good scoper. So first of all, I have confidence in my scope. I see what I see. It's there for me to see, right? Axis 90, pretty clean. It's nice and straight. My little squished oblong, and anyway. So on a 3/4 diopter sill, if that's where it's going to end up power-wise, I don't need it any finer than to the closest whatever. You understand? I don't have axis minus half cylinder at axis 97, okay? If you're going to go 97, say 97 and a half. Because I doubt you could actually tell the difference between 97 and 98. That's like a cup disc at 0.35. Sorry. You could make a better argument for 3.3 because we do see ratios like a third or a quarter or a half much better than we see to the hundredths place. Okay, so anyway, that's just another quick aside. Ciceric, of course, by the way, on that thing, very quickly, did a study with a bunch of dilated people, had people like myself, faculty and students go, and very quickly go eye to eye to eye, and just give me the cup disc, give me the cup disc. Forget the hundredths place. Well, I can't tell if it's a 4 or 5, so I'll go 4 or 5. It's like, pick one. Because for the most part, you actually can't tell to the hundredths place. Okay, it's probably iffy if you can tell plus or minus 1 to the tenths place. Do you understand? Okay, fine. So, 2 questions. It's somewhere in the middle between 75 and 105. And I scoped it at 90. I have a bias towards where I scoped. Okay? Now, power. I switch to power. Do you want less than more than what I scoped, or more than more? Okay? Oh, Dr. Harris, you're a good scoper. Less than more than what you scoped. Okay? Down, down. Okay? I'm framing everything, right? Axis, right? Oh, yeah, it's in between. Okay, power. I'll just do it in the other dimension. I know it's lower than more than what I scoped. We okay with that? So now I'm going to do power again. More than less than what I scoped, or less than what I scoped. Oh, more than less. Cool. So now I'm actually for the first time at exactly what I scoped. Do you want, and mentally I've been recording the speed of response for each of these. You know, towards, yeah. Towards, uh-huh. Less than more, uh-huh. More than less, oh yeah, you betcha. Okay, so now they have to earn the extra sill. I scoped it at 75. I know it's less than 1, I know it's more than a half. If I don't get an immediate, now do you want more than exactly what I scoped or less than exactly what I scoped? If I don't get an immediate more, any hesitation, then I drop it down. They did not earn going to the 3/4.
Can we say that one more time, that last part?
Yeah.
So you scoped.
I scoped 3/4.
Okay.
On the power decision from the 1, they said less. So I have an upper bound.
Yes.
It's less than 1. At the half, they said more than half.
Yes.
So my floor, it's somewhere between half and 1. Could be an 87. Could be a 92. I'm just playing. If I had a continuously variable lens, and actually there was a time in our profession we did, the Alvarez lens was a continuously variable dial-in powered lens. Okay, it's a really cool optics, okay? There are two halves of a lens with weird shape that when you slid them, they changed their power. They were really cool. Two of them at exactly 90 degrees gave you a sphere. One of them, you could rotate it, gave you a cylinder power. They're continuously variable lenses, which I thought was cool. So all I know from those choices right now, with the lenses I have in a phoropter, is it's less than 1 and more than a half, okay? If it's only 0.56, I don't want to give 75. Do you understand?
Yeah, okay.
This is, I just wanted to start giving you those weird numbers so that you were thinking the hesitation is going to be, yeah, I could have scoped 3/4, but it's actually somewhere between 3/4 and a half. And if it's somewhere between it, you didn't earn the 3/4.
I see, yeah.
So the hesitation says you didn't earn it.
Gotcha.
If they say more than 3/4, maybe it's a 0.82. But they didn't earn the 1 because from the 1 they said less.
Sure. Okay.
Does that help make
That makes
sense?
sense, yeah.
Okay, good. I hope it does on the recording as well. So I got the hesitation, I'm down to the 050. 5 questions done. Okay? You with me?
Yep.
Okay. So, close, open, I do the same thing here. I'm not going to go through the same thing. Okay? Still same 20/40 line, random 20/40 line. Haven't chart changed. Now I'm going to go to bino balance. Okay? Because there's a funny thing that occurred. And no one taught you wrong, but in lab, on the papers, they interjected a stopping point to check how your refraction was going. It had a capital letter M on it, and a lot of students ended up associating that temporary stopping point that you write down and called it a manifest, but it isn't your manifest. Okay, yes, I saw the face, Maria, okay? It truly was a monocular refraction. If you go back to that paper and look in the little print, it says monocular refraction. Okay? If you want to get to that stopping place, right, where now you fiddle around with spheres and get 20/20 or whatever you get, and you want to record that, but you haven't done the bino balance, please don't use the word manifest. Record it in the drop-downs in CompuLink. Bartucci and I had added about 7 years ago, we had added monocular refraction. Okay? So we're not saying don't put that in, but if you do put that stopping point in, please record it as monocular refraction. Okay? Because the actual next thing in CompuLink that you should be recording after rep is bino balance. Okay? If you have unequal acuities in the two eyes, amblyopia, macular degeneration, something like that, of course you need to do a monocular refraction. And I know Dr. Lapine likes the monocular refraction, so if you work with her, she probably wants to see that. As far as I'm concerned, it's consuming time on people who have roughly equal acuities. Okay? So I go to bino balance immediately. Now, I was trained, again, I use the other phoropter, and on the other phoropter, I'll just bring it over real quick. There was a device called and I have one here, called a Stevens photometer. It doesn't work on this one, but it plugged into here, and it would come down like this, okay? And first of all, you see these, it's big aperture. So you're not using these Risley prisms. It has 5 up and 5 down, but this is also how I measured my verticals, okay? Tell me when they're level, and you get to the single diopter, right? That would be 4 left hyper. Okay, it's really a cool thing to have. So better optics, so my entire life, because when I would do this, I'd set it this way, and I have 10 left hyper. Okay, I've always had the left eye being the high eye. it doesn't matter, you're taught the other way, as long as you separate things. Now, also check in your rooms over there. 3 and 3 sometimes puts the second image exactly on the bezel of the other thing. So I advocate get into your room, put your 3 and 3, look through it with Plano, and if it does that, you know in this room I need to use more prism. Okay, because sometimes you'll get that, I don't see 2. But it's because the second set of letters is sitting right on the bezel of the other one. Do you all know what I mean by bezel? That's a modern term these days, okay. I know we have bezel-less, no, fine. Okay, so 1, 2, 3, 4. Done this my whole career, and I kick back 1, so I'm biasing it that this one should be better. Just like all my testing with the sill, I'm biasing it, okay? All right, is that blurred? If it isn't, I keep going. Is it blurred now? Good, it's supposed to be, okay? This is part of how I make sure I find all the plus or I don't over minus.
Do you use
Okay.
a 2040 line?
2040 line here, and it should be a little blurred, okay? If they say, it's perfect, I'll keep going in that direction, okay? But again, usually with my scope as a start and with the red-green as a check-in right after scope, I'm usually in about the right ballpark that I should have a little bit of blur at this point. And I biased it. Which one's black? Which one's a little clearer? The upper. For mine, it's just the upper. And then I go down 1, up 1. That's my move, okay? I don't do a single click. So I'm making bigger JMDs. Do you understand? Which one's better now? This one. Wonderful. Back down, I'm finished. I don't even bother to look at the one that's a quarter off. Part of this is in the refraction, this is not a candidate prescription. I don't have to split the hair. Is it really a quarter difference or not? There's other findings in the refraction that are going to help me figure out, or in the analytical, my base in, base outs, that'll give me a sense. I have to prescribe exactly what I find versus I have freedom to not prescribe exactly what I measure. That's a whole nother lecture, okay? And I see you going, wheels spinning, okay?
Yeah.
All right, so how do you see? I've still been on my 2040 line. It's okay, Doc, it's a little blurred, fine. Now, first chart change in a long time, 25, a couple times, so I don't have APE, okay? Can you read it? No. Okay, but I expect in 2 clicks, I expect them to start talking. Okay? Then I go 20, 20, 20, anything here. And on the 2020 line, what I want is, T-E-R, I want it fairly quickly, not a, man, Doc, if you really press me, that could be a T. I think, so I don't want the struggle 2020 line. I want the first, they can read it, okay. Does that make sense? And that's what I record now in CompuLink. Binocular, so this is my bino balance, okay? And you record VA as 2020, because it's the first, most plus, here's the definition of bino balance. Most plus, or least minus to the first good 2020. Okay? Then you have the question of getting to your second endpoint. The one that actually you can call the manifest. Most other schools, or when I went to school, we called it BVA, best visual acuity. Okay? Or the subjective. Okay? All of this testing is subjective testing, but the subjective is the final endpoint. Now, quick story, and we'll finish up with this point, okay? What question do you ask to get now to your best visual acuity? Or maybe I'll do it this way. I was in a study group when I first moved to Baltimore, and once a month, we had about a dozen of us that got together, okay? And we'd had Bruce Wolf actually come in and do two presentations, two-day presentations about a year apart. And it sensitized us to a bunch of different things about the refraction, okay? So we realized that different people in our group were asking different questions at this point, okay? One might ask, which is clearer, this one or this one? One might ask, which is bolder? One might ask, which is blacker? Which is blacker and clearer? Which is bolder and clearer? Which one feels more, I'll make you the hippie, right? Which one feels more comfortable? So, you understand, we had a bunch of these questions. And Dr. Wolf suggested, why don't you all pick some, try them for a month, compare, and see how they go. So it turned out we had 11 of them. And I thought, oh, I'm going to make one up so we have an even 12, we'll do one a month. Okay? So I made one up, but it was based on his presentation. And it turned out for the whole group, this was the one that we've ended up agreeing we'll use. And I used my entire career from that point forward. And my question was a little bizarre. Okay? It was, which of these looks larger? And it is absolutely, totally like Maria's face right now. Counterintuitive. How could less plus or more minus, which is only the direction I'm going, have the person see larger? And I don't have an answer. We think it's because at a certain point there's just the right balance or give and take between accommodation and divergence relationships. And there's a perceptual relaxation that results in the person perceiving things larger. So that's the question I ask. Which of these is larger? At first, it's the bino balance or the bino balance, going a quarter more minus or a quarter less plus. This is bigger. Cool. Which of these two is larger? This one or this one? This one's larger. Which of these two is larger? This one or this one? Ooh, it just got boom. So I go back to the largest lens. The lenses are the same size, but it's the one they perceptually saw the largest through. Okay? And sometimes you go, which is larger, this one or this one? And you go, I don't know, but that one's clearer. It's like, oh, but I'll still keep asking, which of these is larger? Until I finally get something that they're reporting is worse, subjectively. And I go to the last good one. So very quickly, in a progressive myope, the bigger everything else the same, the bigger the difference. If my bino balance is -2 and the largest lens is 275, but in the next one the kid is 2 and 2 1/4, the one with the 2 and 275 is more at risk to progress. Okay, so you can just keep that little factoid back in there. Okay, and then I get my VA through this lens, ODOSOU. Okay, this is my BVA lens, and some of you have seen it. I think it'll take too long to set it up, but we'll do it next time. Somebody remind me. The Shift 60. Okay. The continuously variable visual acuity thing, it's what we use with our sports vision. I use it for every patient. We help develop it up here. It's incredibly fast. And then you can get your accurate acuity like 2011, and OU 29. Okay? And it's faster than doing acuity any standard way that you're actually doing it. So that's you can record this one as your manifest, okay? And that's the order they should be recorded in CompuLink. Ret, bino balance. If you have somebody with unequal acuities or this kind of, you can add your monocular refraction there, then your bino balance, and then your manifest refraction, okay? All right? And I typically add my PRA, NRA, and FCC onto the bino balance line. And in the box that's there, that's where I add my near point retinoscopy. So all of those things are visible to me when I'm looking to actually write a prescription. And I don't think of any of those numbers as actual prescription or prescription candidates. They are simply the universe of the refraction at that moment, time and day.